All right, so I'm going to talk about Post-Acute Withdrawal Syndrome, PAWS, or PAWS, specifically as it relates to alcohol. Okay, sometimes it's referred to as Protracted Withdrawal Syndrome. It's basically the set of symptoms that lingers on well beyond the initial acute withdrawal phase of an alcohol detox. Now, the severity, duration, and frequency of episodes is going to really vary a lot from person to person, depending upon what you were drinking, how much, for how long. But most importantly, it's going to depend upon your nutritional status going in. Okay, so most of the focus of any kind of drug detox is the acute phase. But even if you make it through that without taking the drink, it doesn't necessarily mean that you're in the clear. Okay, and most heavy drinkers or people with alcohol use disorder, continue to be anxious, nervous, depressed, for weeks or months after stopping. They still might complain about insomnia, agitation, strong cravings, stuff like that. And because those symptoms are so common and they're experienced by so many people, a lot of people think that it's just proves that most of these symptoms are mostly psychological or emotional. Okay, but there are other more physiological explanations that you should be aware of, because a lot of these can be alleviated. And we could possibly avoid getting you started on an unnecessary pharmaceutical. Okay, so that's kind of the purpose of this video, just to explain the root cause of a lot of these symptoms and to kind of hash through what PAWS is exactly. As a side note here, about the pharmaceutical approach to recovery, I think that I've made my stance pretty clear in the past. Do I think prescription medication, can be helpful to someone in recovery? Certainly, of course, if it's appropriate. Do I also think that pharmaceuticals in the behavioral health field are overprescribed and can lead to some potentially, avoidable problems down the line? Yeah, I think that too. And this is one of those real tricky areas right here, because there's no clear-cut answer. When somebody just gets sober, they're a few weeks or maybe a month or two, and they're still complaining about anxiety and poor mood, do we just start them on an antidepressant? The medication itself is going to take 4 to 8 weeks to really take full effect. And even by that point, a lot of those PAWS symptoms might have started to be relieved, and you could have avoided that in the first place. So I don't know. I mean, it's a very tough question. It's very nuanced. Every situation is going to be different, but it's worth talking about. I think any situation that comes up a lot is worth talking about, regardless of how uncomfortable it makes somebody. And it's worth noting, that a lot of the panic that leads to starting these drugs, contrary to popular belief, is not just being pushed by the prescriber or even from recommendations from the treatment, center itself, but it comes from the patient. It is scary to think that I've stopped drinking, a couple months ago and I'm still feeling like this. So it's understandable why people might request something, because they just want to feel better. Okay, but it's not necessarily anything psychological. It's not necessarily an emotional weakness that's leading to this. A lot of these symptoms are physiological. So protracted symptoms. Okay, the word protracted indicates that the cells are still suffering the damage caused by alcohol. Alcohol is incredibly toxic. To think you can pour that into your system for years and then stop taking that for a few days or a few weeks, and then those lasting effects don't catch up to you, that's just wishful thinking. Alcohol affects every body system, every cell, and those cells do need time to heal, and they need help healing, okay, for that process to be complete. So post-acute withdrawal, there are 5 main physiological causes, and for the most part, everything that I talk about on this page or post about, it all has something to do with these 5 areas. And they are malnutrition, okay, hypoglycemia, which is to say chronic low blood sugar, autonomic nervous system dysfunction, okay, so that's the regulating of the nervous system that I talk about a lot, cortical atrophy, okay. I'm not going to get into that one too much here, but there's a thin layer of gray matter that covers both of our hemispheres, and that's called the cortical area. And with chronic alcohol use, severe alcohol abuse, it can start to thin and really cause some serious problems down the line, and it takes a long time to recover from that, if you recover at all. If it's serious enough, some of these situations can be permanent. That's like the wet brain that we talk about sometimes, but that's a topic for another time. The fifth cause is going to be neurotransmitter depletion, and that's another one that I talk about a lot. So those are the 5 main physiological causes of PAWS. Okay, so as far as malnutrition goes, all chronic alcohol drinkers are to some extent malnourished. Okay, partly because your diet over time usually just starts becoming crap, but also because alcohol itself interferes with the body's proper absorption and utilization of these nutrients. So just removing alcohol from the situation, although it's very good and helpful, it's not going to magically make malnourished cells healthy again. Okay, the cells need vitamins and minerals and amino acids and fats and proteins and carbohydrates all in the right amounts to start repairing that damage. So this in itself leads to a couple big issues. One is that most chronic alcohol drinkers don't realize that they're malnourished. Okay, and it's it's hard to fix something that we don't know exists. But second, and this is a major problem that I'm seeing right now, and I'm watching it play out in real time, and I don't really know exactly how it's going to be resolved, is so over the last few years, specifically the last 5 years, I'd say, we've become hyper aware of what is considered diet culture, okay, and all the problems that are associated with it. Obsessively demonizing food groups or specific foods can increase the risk of developing eating disorders and body image issues. All things that are huge problems in the fitness world. We see it with fitness influencers, to some extent in the nutrition world, nutrition influencers, stuff like that, where somebody's very popular, influential, and the message is delivered in a careless way, and it can potentially lead to some problems down the line. Okay, our clinical literature is really spelling that out pretty clearly for us. And a lot of people are vulnerable to this, especially people recovering from addictions. They're extra vulnerable. So it's a good thing that we're aware of it. But as usually happens, with problems as they come into mainstream awareness, is that the pendulum swings, kind of completely back in the other direction, and we become hypersensitive. Okay, so now anytime anyone is talking about food or healthy lifestyle, a lot of our radars go up, and we might discount those ideas outright as just, oh, that's just part of diet culture, and that too is a problem. Okay, so that's what I see in the recovery community a lot. People telling other people, oh, don't worry about what you're eating. Don't listen to this person. Eat whatever you want. As long as you're not drinking. There's a popular book that came out, a few years ago. A lot of you guys might have read it. The F-It diet. That made a lot of people feel better about just eating junk all the time. And when I use the word junk, by the way, or junk food, my general definition is it's factory infused with refined sugars and salt for the specific intention of making it hyper palatable and addictive. Okay, that is my working definition of junk food. So, do you have the right to consume all of that stuff that you want? Of course you do. Do you also have the right to be as anxious and depressed and nervous and fatigued as you want? You have the right to do those things as well. So my whole thing is that you can reverse the effects of malnutrition without necessarily becoming obsessive about one particular food or food group. Okay, another area involved with malnutrition is hypoglycemia, which is chronic low blood sugar, extremely common in all phases of alcoholism. Okay, it's usually caused by disorders of the liver or the endocrine glands, and it affects the body's ability to store and release sugar. When a lot of people with alcohol use disorder consume alcohol or just the really concentrated processed sugars, the blood sugar spikes, and then a couple hours later, it really falls precipitously. Okay, the low sugar levels cause very specific and definable symptoms. This is your fatigue and headache and forgetfulness, inability to concentrate, anxiety, maybe shakiness. These are very, very predictable. The problem is that one or two alcoholic drinks, or even just some of the concentrated processed sugars, they can relieve that instantly and make you feel remarkably better. The depression and anxiety that you were feeling 5 minutes ago, it's miraculously gone. So it's tough because that becomes reinforced. We see it in the 12-step rooms a lot. It's not only accepted, but it's a lot of times it's actively promoted. What it looks like is this: a newcomer will come in. They'll be complaining about maybe cravings or feeling irritable. An old timer offers them a donut from the table. And then 5 minutes later, they say, how are you feeling now? And then the newcomer says, I feel better. And then he says, see, I told you. Now, the problem is that he might not be with you 2.5 hours later when your blood sugar crashes and now you're feeling worse than you were before. And so much time has passed that you aren't necessarily associating those symptoms with what you ate. So everyone's none the wiser. It creates this reinforced cycle, which eventually makes all these symptoms I just mentioned more frequent and more intense. The old timer reinforces, the belief that sweets help the new person, and the new person reinforces the belief that sweets are the cure for cravings and anxiety. Okay, and ultimately, the only way to reverse this process is to control the level of sugar in your blood through dietary means. Blood sugar issues are not universally a problem, but they're more the rule than the exception in alcohol recovery. If you're not sure, you can get checked by your family doctor. It's a glucose tolerance test, GTT, or you can just pay attention to how your body feels a few hours after you eat a lot of processed sugar. If you're really kind of tuned into your own body, are you suddenly irritable, anxious, depressed, tired, and is it like that predictably every time you do it? So unfortunately, most treatment approaches leave out the nutritional piece, and like I said before, although of course there is a time and place for medications, if your symptoms are nutritional, an SSRI is not going to make that type of depression go away. Okay. Also, correcting your nutrition helps heal the autonomic nervous system. Okay, chronic alcohol use can disrupt the ANS, which is involved with the involuntary glands. Okay, the heart, digestive system, respiratory system, the skin, all the areas that kind of feel out of whack when you stop drinking. And this shows up as rapid heart rate, kind of quick and shallow breathing, a lot of sweating, maybe a tremor. These are all signs of malfunctions in the autonomic nervous system. And then the last area that I'm going to mention is just with neurotransmitter depletion. And I talk about this one a lot. I have a lot of posts about this. You can reference some of those. maybe I'll make a video in the future because this one's already running a little bit long. I'll do a video and I'll talk about that specifically. That's very, very common, in people recovering from alcohol and drug addictions. With alcohol, serotonin deficiency, for example, very, very common. It's related to mood and sleep disturbances, specifically stage 4 deep sleep. Okay, so that will affect energy levels, motivation, as well as some other things. So that's the basic gist of post-acute withdrawal syndrome, of PAWS. It's very, very common. It can be really uncomfortable and concerning because you might not recognize that it's related to the physiological effects of alcohol. But minimizing junk food, eating nutrient-dense foods, supplementing for a little while if you need to, and of course removing the offending agent, removing alcohol, all that stuff really goes a long way. It's a big topic. It's an important topic. I hope I did a decent job here of explaining some of that. Leave a message if you have any specific questions about it.